In today's show, we're going to talk about 15 ways to reduce your blood pressure from this book by my friend, Dr. Mark Houston. The title is The Hypertension Handbook for Clinicians and Students. I would highly recommend this to all of you because it's a very detailed book about the etiology and the root cause of high blood pressure, why it's a problem, and reframing the conversation about hypertension or high blood pressure as a disease of your endothelium or your blood vessels. This is the biggest organ in your body. Your blood vessels outweigh your heart by weight more than 5-fold. If you were to stretch out all of your capillaries, your arterioles, your veins, and all of your blood vessels, it would encompass or cover 6 tennis courts. So this is a massive organ, and it is at the root cause of hypertension, cardiovascular disease, cerebrovascular disease, and all the sequelae linked therein. Now, in this book, Dr. Mark Houston talks a lot about how insulin resistance and abdominal or visceral adiposity are at the root cause of all of the sequelae linked with elevated blood pressure, and how elevated blood pressure causes end organ damage in your kidneys, in your vessels, your endothelium, in the brain, in all sorts of different tissues in the body. And unfortunately, many people have hypertension or high blood pressure. It's about 30% of American adults or 60 million Americans. So it's really important that we talk about the science here, this new way of viewing hypertension, and natural strategies, about 15 natural strategies to reduce your blood pressure. So in this book, Dr. Mark Houston talks about how hypertension is a chronic disease of the blood vessels, impacting some 30% of adults, more than 60 million Americans. It's the most common medical problem that many clinicians face. Many people in your family, possibly you, have elevated levels of blood pressure or hypertension, which is why you should invest in an at-home blood pressure cuff. I strongly suggest this. There's ones that you can get at Walgreens. I went to Rite Aid, spent $29. It's a wrist cuff. It's better than nothing, but it's a good way to see if you have elevated levels of blood pressure or hypertension. You know, the cut points here are a diastolic and systolic pressure of milligrams per mercury, 120/80. You definitely want to be at or below that when you get up first thing in the morning. Now, one thing that's worth mentioning that I've learned from Dr. Mark Houston is the diastolic number is actually a little bit more important. For example, let's say your blood pressure is 120/90 or 120/110. That diastolic number, the number on the bottom, that is going to be your static sort of background pressure. That is a little bit more important, and that would indicate greater emphasis on therapeutic lifestyle change in the 15 different ways that we'll talk about shortly about how to reduce your blood pressure. So keep that in mind when you're testing your blood pressure. Also understand that if you're experiencing a stressful situation, a stressful work call, your children are yelling at you, it's expected that your blood pressure would naturally rise. And this is why it's good to test first thing in the morning. You get up, drink some water, test your glucose, test your blood pressure. This is a good way to check in to look at your overall cardiometabolic health. Now, again, as I mentioned, the problem with elevated blood pressure is end organ damage to the kidneys, to the heart, to the entire vascular system, and the cerebrovascular system. This is the network of capillaries and arterioles that innervate and help with brain blood flow. And so when you have high blood pressure within the brain, that is causing problems that can cause micro damage to the circulation and increase your risk of having cerebrovascular disease, a stroke, and even possibly dementia. And this is obviously at the root cause of the number one leading preventable cause of mortality, which is cardiovascular disease. So you hear a lot about lipids, and we've talked about lipids and the importance of avoiding industrialized seed oils to prevent LDL from oxidizing. But let's focus today more on blood pressure and why it's so important. And as is talked about extensively in this book, specifically on pages 3, as well as pages 47 in this book right here that I'll link on Amazon, therapeutic lifestyle change is the number one way to reduce your blood pressure. Sure, there's calcium channel blockers, ACE inhibitors, angiotensin receptor blockers, thiazide diuretics, beta blockers. All those drugs are widely prescribed and people use them. But your lifestyle, your sleep, your stress management, your exercise, your micronutrients that we're going to get into, prioritizing protein, all of these things are very important for reducing blood pressure. Okay, but what are the other factors here? Elevated triglycerides and oxidized LDL. Okay, this is the number one thing here listed on page 47 as a reason why blood pressure increases. And number 2 is insulin resistance and glucose intolerance. We've talked a lot about how 96% of American adults have some degree of poor metabolic health, and that is at the root cause of both cardiometabolic disease, and also hypertension. So that's really important to recognize. Glucose intolerance drives many of the pathophysiologic abnormalities that are experienced in the context of poor cardiovascular health, specifically hypertension. Part of that has to do with the endocrinology type changes, increased sympathetic tone, cortisol, adrenaline, noradrenaline, and also changes to the RAS system, the renin, angiotensin, aldosterone system, which ultimately impacts the hemodynamics of the blood and blood pressure. Number 3 on the list is belly fat. Number 5 on the list is electrolyte and kidney dysfunction. So changes in creatinine, changes in uric acid, changes in blood urea nitrogen, electrolyte imbalances, dehydration, all of those factors. It turns out that the kidney is both a causative factor driving hypertension, but it also is a target of hypertension as well. The kidney is a very important organ. And actually, Dr. Peter Attia did a great job talking about the importance of kidney health in the context of longevity in a recent podcast with Dr. Andrew Huberman. I will link that here below. Number 6 are abnormalities of the vascular smooth muscle cells. And we've talked a lot about glycation. So this goes back to point number 2 about insulin resistance. When you have impaired glycation and the whole glycome that we talked about several weeks ago, that can impact the smooth muscle cells, compromise the endothelium, leading to endothelial dysfunction. A symptom of endothelial dysfunction is erectile dysfunction. That's one of many symptoms. Number 7 here is coagulation imbalances. So being in a prothrombotic state, having blood viscosity, iron overload, being dehydrated, all of those factors, for example, elevated serum ferritin, elevated hemoglobin, hematocrit, RBC, RDW, all of those factors can play a role in the thrombosis or thickness of the blood, increasing shear stress, viscosity. That can increase pressure, which can be problematic. And number 8 is endothelial dysfunction caused by all of the above, as well as other factors. And number 9, and this goes back to number 2, insulin resistance, and that is vascular inflammation. So this can come as a result of poor diet choices, for example, having processed food, industrial seed oils, all of the different factors, plus all the inflammatory tone linked with increased visceral adiposity or belly fat, sedentary, and the like. And so really important, again, just to highlight, viewing the endothelium as an organ and that hypertension or high blood pressure is a disease of the endothelium. It's the largest organ in the body. It outweighs the heart 5-fold. And if you were to stretch out all of your endothelial tissue from your capillaries, your arterioles, your veins, and so forth, it would cover 6 tennis courts. It's the largest organ in the body. Now, before we get into all the different supplements and different tactics and dietary strategies, I just want to say thank you for being here. If you're enjoying this content, please hit that like button. Be sure to leave a comment below. That really helps the algorithm and people like you get access to the content that we produce. Also, sharing this video as a direct text message goes a long way so that other people have science-based tools and solutions to support cardiometabolic health. Speaking of cardiometabolic health, one natural product that we're going to talk about a little bit later and also right now is berberine hydrochloride. This is arguably one of the most safe and effective natural products to support metabolic health and enhance your fasting physiology. So a great tool to consider is a berberine fasting accelerator by Myoscience. Each capsule contains 250 milligrams of a purified berberine hydrochloride. Again, this has been widely used in traditional Chinese medicine for 3,000 years. We're now learning much more about it. Scientists are studying and publishing 700 plus articles on berberine every single year. You can read some of the hundreds of reviews over at myoscience.com. A lot of people are using this to kickstart their fast, to have it 1 or 2 capsules with their evening meal or shortly after their evening meal to suppress those evening food cravings for hyperpalatable processed foods like cookies and crackers and treats that we're all susceptible to overindulging, and that can compromise your cardiometabolic health. So check it out over at myoscience.com. Use the code podcast to save 12%, MYOXCIENCE.com. Save with the code podcast at checkout. So let's talk about the 15 different ways that you can reduce your blood pressure right now. Number 1, salt is really conflicting. Some people will say, well, part of the reason why you get high blood pressure is a salt deficiency. If you look at some of the other strategies like the dietary approach to stop hypertension, the so-called DASH diet is a low sodium diet. So in this book, Dr. Mark Houston does recommend sodium restriction depending upon what subtype of hypertension you have. And so you can figure that out by doing the renin, angiotensin-aldosterone testing, the RAS testing that he recommends here to see in drug-naive patients. So if you've never taken a thiazide diuretic, a beta blocker, an ACE inhibitor, calcium channel blocker, then you can figure out what factors are driving your hypertension and how to best approach that. But salt is conflicting. So I would just say this is probably a personalized thing that you need to consider. For some people, elevated levels of sodium, particularly in hyperpalatable processed foods, could be a problem. But if you look at the work from Dr. James DiNicolantonio and the Salt Fix, in that book, he provides a compelling argument that salt deficiency is actually driving hypertension. So there's conflicting data on this. And I think personalization really matters here. And so I think it's important that you figure out how much sodium or real salt you're having and what your blood pressure is and manipulate that and see what that does to your pressure. That being said, there's more consensus on eating more potassium as a way to reduce blood pressure. Dr. Mark Houston recommends up to 4 grams per day of potassium, which I know sounds like a lot. I wouldn't start jumping in there, but supplementing with electrolytes. Most quality electrolyte products have 400 to 600 milligrams of potassium. Avocados have potassium as well as bananas. There's potassium in bone broth, for example, in real foods. So make sure you're eating more real foods. Now, when it comes to magnesium, this is where I think, again, there's no ambiguity about the benefits of magnesium. Between 500 and 1,000 milligrams of magnesium, preferably a form like magnesium bisglycinate chelate, magnesium malate, or possibly magnesium L-threonate. Magnesium citrate is not really well absorbed. It's great for inducing a bowel movement because it's actually poorly absorbed. It ionizes in the gut and attracts water. So that's not the form of magnesium that you would want if you want to reduce your blood pressure. Also, number 4 on the list is zinc, 25 milligrams per day. There's a lot of good data to show that zinc supports hormonal health. Zinc also is a cofactor in, I think, 250 enzymatic reactions. A lot of people are zinc deficient. So that's important. Now, number 5 on the list is protein. Dr. Mark Houston recommends between 1 and 1.5 grams of protein per kilogram of body weight, ideally ideal body weight. So consider that, because we know protein is important for improving and supporting lean body mass. It has a thermic effect. It's very satiating, especially in comparison to carbohydrates and fat. So protein targets are important. He also recommends supplementing with whey protein, 25 to 30 grams per day. Whey protein has been shown to reduce blood pressure, according to several studies. So that's important. Under the protein category is having fermented soy protein like natto periodically. This is not something I would necessarily supplement with. I would go to an Asian market, buy some Japanese fermented natto from organic non-GMO soybeans. You know that fermentation of soy helps to decrease some of the lectins and anti-nutrients and possibly phytoestrogens and increase levels of vitamin K2. We've talked about in many other videos the importance of vitamin K2 for helping to prevent arterial calcification and damage to the smooth muscle cells. So that can be very important as well. He recommends consuming this 2 to 3 times per week. Again, under the protein category, having more cold water small fish like sardines and such 3 times per week. So having a can of sardines that is free of BPA and bisphenols in the packaging. There's a few brands that I can recommend. Wild Planet is one that comes to mind, 2 to 3 times per week. Okay, number 6 on the list is essential fatty acids. And we've talked a lot about the omega-3 index test, and we've had Bill Harris on the podcast before, and I've talked a lot about the importance there. Keeping your omega-3 index above 8% is ideal. What does this do? Well, this helps with elasticity of the blood vessels potentially, and decreasing the inflammatory tone. Number 7, GLA. So gamma-linoleic acid is the only anti-inflammatory omega-6. Dr. Mark Houston is a big fan of this. There's a fellow by the name of Floyd Chilton out of Wake Forest University who has published a lot of research showing that GLA can be effective, probably more effective for women. This is found in borage oil, black currant seed oil, and again, it's the only anti-inflammatory omega-6 fat, and so that's on the list. Number 8 is restricting carbohydrates. We know that most people overconsume carbohydrates in proportion to their physical activity. So if you're not regularly exercising, you're not an athlete, you don't need cups and cups of pasta and bread and rice. So minimize that, because it goes back to the number 2 factor driving hypertension is insulin resistance. So minimizing especially the ultra-processed carbs, the sugars. If you're having fermented potatoes, for example, or whole real fruit, especially around exercise, probably not a problem. But we're going to talk about body fat percentage, cut points and thresholds, and neck size in a moment. if you fall into the more overweight, more increased belly fat categories, then you should minimize your carbohydrates. Garlic, having 3 cloves per week. And so this is actually interesting. There's some really good research on garlic. This is one of my ultimate favorites here. Number 9 is mushrooms. Having mushrooms 3 times per week has been shown to reduce blood pressure. People say, well, what kind of mushrooms? Is it the button mushrooms at the grocery store? I love shiitake mushrooms, maitake mushrooms, oyster mushrooms. I think it's good to find morels in the spring. As we put out this video, it is spring, so you might be able to find an area of a forest near your home where there was a burn recently. Maybe a piece of land got caught on fire. There's a forest fire. That's a great place to find wild morels. These sell at grocery stores for $40 a pound, but you can go find these in the woods, and that's great. Dried seaweed. So I just have a little dried seaweed here. So this is something I cook with periodically. Bonito flakes, you get iodine, you get sodium, but seaweed has been shown to lower blood pressure. So most grocery stores, particularly natural food stores, if you go to the section that has coconut oil and curry spices and stuff, they'll have seaweed flakes. It's not something that you have every single day, but periodically throw these in dishes. They'll increase the spice, make it more palatable, more flavorful. And according to several studies, consuming dried seaweed can lower blood pressure. This is another interesting one here. I think this is around number 12 or some such. 13 is celery. Having at least 4 celery sticks per week has been shown to lower blood pressure. So nice little low carb snack, and better, healthier than having potato chips and cookies. Make some guacamole. It has potassium, have some celery. It's been shown to lower blood pressure. Okay, let's talk about exercise. Really important. I mean, this should actually be in front of diet, but everyone has to eat. But exercise is really important. So when it comes to cardio or aerobic exercise, you want to be burning 4,000 calories over the course of a week. So if you go, for example, on a hike, you're probably going to, and it's vigorous, undulating terrain, maybe it's steep for a minute, then it's flat, steep, you might burn 600 to 700 calories. If you do a HIIT class, F45, Orange Theory, you go do CrossFit, you might burn between 600 and 900 calories per session. If you go for a walk with your dog and your friends and family, you might burn 200 calories per session. So you want a cumulative calorie burn of about 4,000 calories per week. Also, resistance training. We talked about the importance of that. Numerous videos and podcasts over the last several years. At least 3 days per week. I'm a little biased. I think 4 days per week is optimal for building and maintaining muscle, but at least 3 days per week. Try to hit every major muscle throughout those different sessions. Now, let's talk about body composition cut points. And I think it is good to get a flexible tape measure so you can look at your waist circumference, you can look at your neck size and stuff, and also maybe do a DEXA scan or underwater weighing or a minimum bioimpedance scan with the in-body. So the body fat percentage that you want to be under is 21% for women and have a less than 35-inch waist for women. So that's really important. For men, the targets are a little bit lower in terms of body fat percentage. For men, ideally body fat would be under 16% and a waist would be under 40 inches. And what's interesting is neck circumference or neck size is correlated with blood pressure. So for men, you want to have a neck smaller than 15.5 inches. For women, under 14.5. Now, you can actually see this in people that have classic hypertension, insulin resistance, metabolic syndrome. If you're out in public, they'll have a thick belly, very thick neck, sort of red in the face. These are futures that there's this underlying metabolic inflammatory tone going on, and that's problematic. So again, these are just cut points. It's not like, you want to measure your neck every day, but if you have a very enlarged neck and you're also not doing deadlifts or power cleans or things that would warrant increasing neck muscle and trap muscle, it's probably because vascular resistance and or insulin resistance, sleep disordered breathing. And so an enlarged neck is a risk factor for hypertension. Finishing off with just a few specialty supplements, I thought this was quite interesting. Taurine, 2 to 3 grams per day. You know that people think taurine and Red Bull. Taurine must be stimulatory. No, taurine is an amino acid that actually has very protective effects in the heart. It's concentrated in the heart. It's used during exercise. Taurine is a really interesting carnonutrient. And so if you're a vegan or vegetarian, you're probably not getting enough taurine. You might want to aim for supplementing with that. In some of the Myoscience formulations, we put that in the NAC glycine combination and the electrolyte sticks and the MyoRelax and Calm. Taurine is an awesome nutrient. And Dr. Houston recommends 2 to 3 grams per day. Coenzyme Q10, a lot of people think hypertension, coenzyme Q10. This is actually, by the way, really low in the list after all the other factors. He does recommend 60 milligrams twice per day. coenzyme Q10. A lot of people get caught up on ubiquinol, If you take ubiquinol, it's probably a better antioxidant if you want to increase your CoQ10 levels, serum CoQ10 levels. Probably just take ubiquinone. It's much more affordable. It's converted in the body. Both forms have some interesting gastrointestinal absorption. It's kind of like berberine. Probably not worth the extra money to spend on ubiquinol. So just buy ubiquinone. It does increase serum CoQ10 levels. Okay, N-acetylcysteine. We know that that's involved in glutathione production. It's a sulfur-containing amino acid. NAC has been shown to support blood pressure health, 1,000 milligrams per day. And last but not least, on the specialty supplements, L-arginine. We know that L-arginine is a precursor to make nitric oxide that helps to relax and vasodilate the blood vessels. He recommends, again, in more severe cases of high blood pressure, 5 grams twice daily, probably paired with citrulline and folate and that. Now, it's important to finish off on some of the drugs because what I've noticed, when I started working with Gerard Guillory in Colorado and working with people clinically, is many people would have insulin resistance and hypertension, but they were being prescribed a beta blocker from their doctor. Now, the interesting thing about beta blockers and thiazide diuretics, which are arguably two of the most commonly prescribed antihypertensive or blood pressure lowering medications, is they induce insulin resistance. So you're sort of robbing Peter to pay Paul. You're trying to reduce the pressure in the system. At the same time, you're actually causing insulin resistance. And that's a problem. So Dr. Mark Houston does recommend people consider ACE inhibitors or angiotensin receptor blockers, ARBs, as a sort of primary or frontline treatment as opposed to jumping to thiazide diuretics and beta blockers. Now, of course, if you're working with a cardiologist who's doing advanced testing and all of this, that's a different conversation. But if you just go to your primary care doctor, they find out that you have hypertension and they prescribe you a beta blocker or a thiazide diuretic, you might want to go back to them and say, you know what, could we possibly shift to an ACE inhibitor or an angiotensin receptor blocker? Because these don't have the side effects that the beta blockers and the thiazide diuretics do, but they achieve the same goal of reducing hypertension. So that's important to recognize. I have many people that I've worked with over the years who absolutely feel terrible on a beta blocker thiazide diuretic combination. They shift to an ARB or an ACE inhibitor and they feel much better. Also, calcium channel blockers can reduce pressure in the system and don't have those side effects as well. So it's important to know this information because your doctor will often give you resistance and say, if you go off the beta blocker, if you go off the thiazide diuretic, your heart will turn to mush or your blood pressure will increase. While that may be true, there are other alternatives to those two medications. Again, beta blockers, thiazide diuretics that have less side effects, like an ARB or an angiotensin receptor blocker or calcium channel blocker. So that is it for hypertension. I know that was a very quick crash course. I want to thank my friend, Dr. Mark Houston, for writing this book. I will link it in the description below. His information is remarkable, and he really practices what he preaches. I've traveled with him before. He's getting up at 5 in the morning. He's at the hotel gym. He's doing push-ups, CrossFit, workouts, high-intensity interval training. He's lifting weights. He looks great, and he's really trying to help people better understand how therapeutic lifestyle change should be the primary way to reduce blood pressure, which is a very common chronic disease of the blood vessels. So hopefully you found this video helpful, and the links will be below to the content that we talked about, referenced herein, as well as detailed show notes so that you can refer back to this. As always, if you enjoyed the content, hit that like button. Thanks for watching all the way through, and we'll catch you in a future video down the road.